All right, here we go. We're going to go through the diagnosis list. I'm doing it off of my own video that I took last night while she was doing the live to quote unquote prove us wrong. Here we go. If you want to know what timestamp it is, it was at 42:55.
So I'm going to hold this up to the screen. This is too much to read, okay? It snowed here for 2 days, that's it. And then a night. Okay. Is everybody ready? Because once I get this up, I'm going to hold it up for like 2 minutes. And that's it. It'll give y'all time to screen record and picture take or whatever.
Oh, let me start. I got to give the disclaimer. I am not violating HIPAA. She put this up on her own accord for proof that she is in hospice and has 3 to 6 months now. Even though our calendar has, she's literally any moment passing. She now has been given 3 to 6 months more. Okay. Just so you know, Daisha was told, her daughter was told 1 month. Okay. I have 20 years in fire, doing medical calls as well as fire calls, but mostly medical because that's my thing, that's my training. I have 12 years experience as a medic in the emergency room and 1 year in critical care medicine. This is just my personal opinion, running off my experience and my training. I also run this through my husband, who has 15 years in cardiology and 14 years in EMS. And he agrees.
Here. But after that, it's over. It's done.
Okay.
Y'all understand me? The ones that, are in your head. I put in the comments y'all ready. Because once I start, so it's coming to make sure that my info is. Think we're good. Okay.
And once again, it's mirrored.
4
I know as still as I can.
You can't see
everybody get your pictures and your screen recorder or whatever.
There's a picture.
Do it now because I ain't holding it up but for 2 minutes. This is everything that is medically wrong. Like I said, you'll have to screen record it or take a picture and you can read it upside down.
There we go. I
Or
see
you can read it
degenerative
right side up
arthritis.
if you take a picture or screen record it.
Okay.
That's the best I can give you.
I'll have to
Everybody that
transcribe it.
doubted me, take a picture or record it and be done with it. So take a picture or screen record it. When you're done, you can turn it over and read it on your device. I know I shouldn't have to, but like I said, I love proving people wrong.
Okay.
And this is what I'm proving them wrong on.
Okie dokie.
So that's exactly what I did. I took a screenshot of this clear shot here, which you can do yourself, at timestamp 44:59 on my video from last night. That's the clearest shot you get. Take a screenshot of it and then go into your tools and reverse the image. And I'll show you what we get. Okay, it came over in the light. So I hope everybody can read my scribbly writing. There's my cactus. Remember Kitty Cactus from Halloween? Look at how big he is. Ooh, I gotta transplant him. All right, Kitty Cactus, you can sit there and watch. Okay? Okay. So this was in order, which is important because Dr. Carolina Thomas and her cute little picture there, nice looking little young thing, puts things in order of importance during that specific visit. I believe the visit was November 29th. And we're going to also include the med list, okay? So the very first thing was hypertension caused by heart and kidney disease with renal failure stage 1 through 4. Okay, she has posted 2 previous echoes from February 2024 and July 2024, both of which showed, and I mentioned that in the videos we did, labile hypertension, hypertensive crisis. Okay, it's not really to the crisis stage with this woman. It's more the hypertensive urgency stage, which is just below crisis. Crisis tends to be like 200 over 120. She runs 160 to 180 normally, and that's most likely the combination of her kidney disease and her valvular insufficiency, which we knew about because remember, in November or December, she went for that consult. She took her best friend. She went for the consult while on hospice for a valve replacement. Sorry, I had to get my coffee. Yeah, you heard me right. On hospice, valve replacement consultation. So, that very first one doesn't strike me as anything significant. The second one was the need for her diphtheria, tetanus, pertussis vaccine. You do not get vaccinated on hospice. There is no need for vaccinations, okay? Seasonal allergic reaction. She has allergies. Everyone does, pretty much. Especially this year with the wacky weather. Familial iron overload. Okay, that is a very easily treatable condition. Aortic valve insufficiency, which on her 2 previous echoes we saw was barely moderate. Okay, from the numbers. Enough that she could get a consult for a valve replacement, which would really help her. Stage 3A kidney disease, not failure, disease. Now, it sounds scary because what we do in our heads is we think stage and we correlate that to cancer diagnosing stages. Kidney disease is different, okay? I have a friend on YouTube who's a creator who has end-stage kidney failure. Goes to dialysis 3 times a week, has a job, goes on trips, has relationships, on dialysis, with a shunt and all. When you do kidney disease staging, it sounds really scary because they give you these high numbers of 3s and 4s. This is treatable, okay? Treatable. 3A is treatable. Got that? Not by a transplant. It's treatable. Hypertension, hypertensive urgency, we discussed that. She always runs about 180 over 100. I think the one echo she, after 15 minutes, because usually, they take your blood pressure when you first come in, but you might be afflicted with white coat syndrome, which many people are. They get nervous, they get anxious when they go to a doctor, especially if they have something wrong with them, or they're about to hear some bad news, or they think they will. Their blood pressure rises. It's a natural response. So what they'll do is if they see a high blood pressure, they'll generally do it on the opposite side. So they'll take it from both sides of your body. If it's different, that can be a sign of a stroke, impending stroke, TIA, etc. They didn't do bilaterals on her. No, they just took it 15 minutes later or after the echo. And it would come down. 160s over 98, like that. But she always runs high because of her kidneys. When you have a fucked up kidney, it tends to make your blood pressure rise. Encounter for preventative, and I capitalize that because that's important, preventative adult health care exam with abnormal findings. Well, of course, anything outside of normal, even seasonal allergy reaction, is abnormal. Okay? So don't think abnormal findings is like woo woo. Seasonal allergic reaction would be abnormal because normal folk don't have allergies. Got that? Preventative is the key word here. She had a preventative adult healthcare exam. If you're on hospice, you're not getting prevention of anything except for discomfort. Chronic bilateral low back pain with right-sided sciatica. Well, welcome to the club. Mine's on the right too. Chronic bilateral thoracic spine pain. Welcome to the club. Chronic narcotic dependency, not addiction, dependency. Welcome to the club. As I've said, I was born with an ultra-rare disease, which means less than 250,000 people in the world have it. And I take methadone off label. I take 30 milligrams a day, split 3 times. I have for over 25 years because for some reason it keeps my throat from swelling shut. Sometimes us rare disease folk and ultra rares, we use weird medicines in weird ways because doctors can't figure it out, but they discover it works for us. That's a dependency. I need to take it to prevent my throat from swelling. So that means I am dependent on that medication, and it happens to be a strong narcotic. That's what she has. She's not in addiction, but then again, there were missing diagnoses. So there's 3 of them that are missing. That would be interesting, especially the last 2. She has chronic neck pain. Welcome to America. Everybody has neck pain here. And if you ever worked in healthcare, you have neck pain. Actually, if you just worked, I think you had neck pain. Pulmonary hypertension. That I said long ago I suspected she had. It just so happens Hubs is the assistant for a cardiologist whose specialty is pulmonary hypertension. Up here in Methland, we have 18-year-olds that have pulmonary hypertension. Meth use, for some reason, really causes you to have pulmonary hypertension. He has some people that are 24, some patients, they're like 24 years old and they're end stage, which is really sad. It's just, I used to say I wished schools would show pulmonary hypertension end stage patients to school kids, because I think that would keep you from using. It's not pretty. It is really not pretty. It can also occur familial. It tends to run in families. It tends to skip a generation, which is interesting. One YouTuber that's facing this is Chantal Foodie Beauty. Her grandma died of pulmonary hypertension, and it skipped her mom, and she was told a few years ago that she had the beginning signs of it. Not uncommon for the familial kind. It can also occur in childbirth, which is really sad. But that tends to happen during delivery or shortly before. It can run with eclampsia and preeclampsia, hypertensive emergencies, and it is one of those things where it is just like the heart failure. It can go from 0 to end stage in a heartbeat. It's really sad. I've seen a couple patients that were needed to be transported to the airport to be flown out to Davis, who had been in the delivery room and suddenly went into severe pulmonary hypertension. and had crisis and had to be flown out without the baby, which just broke my heart. Treatable. So the next one was missing, which is interesting. Whenever something is missing on a diagnosis sheet, there's a reason. She has hypokalemia, which is low potassium, and we heard she already is on a potassium supplement. She's got vitamin C deficiency. She definitely does not eat right. That is definitely a poor nutrition. She has a underactive thyroid, which we know she takes Levo for. She has an iron deficiency and anemia. She's on an iron supplement, which occurs with people with familial overload, but she apparently does not have symptoms of it. She's gone the other way. She has a left carotid bruit, and it's really far down the list. Okay, so they're not really concerned about that. They just happen to find it during her echo. That is where you have the beginning of plaque buildup, and it makes a whooshy sound when they listen to your carotid. And they can easily correct that with surgery and empty it out. Oh, I gotta take the dog out. She has chest pain secondary to insufficient blood to her heart. That is her aortic valve insufficiency, which she had a consult to replace. She has vitamin D deficiency. She doesn't go outside very much, and she's eating a poor diet. Under care of pain management specialist, and she has amenorrhea, or her periods have stopped. So she is currently on medications that counter all of this. Every single thing is treatable. Don't let the 3A fool ya. It's not kidney failure, it's kidney disease. That is treatable. So this is not the diagnoses of a hospice patient. It would say on the very top, hospice patient. It would then give her diagnosis that correlates to hospice care. They have to put it at the top that it's a hospice patient, because billing has to justify anything they do. That's why they have to put everything you've ever been diagnosed with in here. Billing, every insurance company wants to reject paying for anything. So if you're a hospice patient, they have to put it right at the top, because that goes under a different billing structure. These are all treatable. She's being treated. This makes me angry, because this is deception. I'm suspecting we haven't seen Betty in a long time, and she was in the hospital last summer. So I suspect Betty is on hospice. And let's not forget that in the video last night, her hospice notebook said admission packet on the front. Hospice notebooks don't say that. She's probably got the consultation for the valve replacement, and that's her notebook. This just makes me angry, because hospice nurses are absolute angels. Hospice caregivers are absolute angels. Those families go through hell, and those hospice staff members, nurses and caregivers, are there to help you. Hospice doctors are there to help you. She saw a nurse practitioner. A nurse practitioner. Provider with Northeast Georgia Physicians Group, specializing in family medicine. You put the information out there. You told people to look at it and to shut up, because this was proof. You opened the door, as the legal profession says. So we checked. This is deception at its finest, and it makes me fucking angry.